In this portion, we will discuss complication prevention. The two biggest complications we will discuss are infection and blood clots. Continue to brush and floss your teeth daily. Good oral hygiene is important for good health overall. Before surgery, you will receive a special soap called HipaCleanse. You will wash with this for 5 days prior to your surgery. The night of your first wash, please change your bed linens. Please wear clean pajamas to bed each night after washing with this soap. This will cut back on the normal bacteria found on your skin and in your environment. No shaving at or around the operative area for 1 week prior to surgery. Shaving can cause little nicks in the skin where bacteria can get in. Prior to surgery, you will have 2 swabs of your nostrils taken. The first time is to screen for MRSA, which is a bacteria that can live on your skin. This test has to be done more than 5 days prior to your surgery if possible. MRSA can lead to infections that are difficult to treat with our normal antibiotics. If you test positive for MRSA, we will prescribe an ointment to use in your nose for 5 days. We will also have you use the HipaCleanse shower for 7 days. When you are in the hospital, you will see staff wearing yellow gowns when they are visiting you. This is to protect from the spread of MRSA throughout the hospital. If you tested negative for MRSA, we will not call you, and you will follow standard guidelines. The second swab we will perform is a Covid-19 test. This has to be done within 48 hours of your surgery. We advise you to quarantine between your test and your surgery. Anyone who is coming to visit you, whether it is your provider, nurse, physical therapy team, friends, or family, should be cleaning their hands frequently. Staff will wear gloves for all procedures. Our hospital is equipped with 7 operating rooms that are located in an operating suite. This is a sterile environment. Each operating room is cleaned between each case using a special protocol. Each room is also equipped with special ventilation, which helps reduce bacteria in the air. Every patient gets antibiotics through IV before and after the procedure for about 24 hours. We also wear these special suits pictured here during total joint replacement surgery to help reduce the spread of bacteria. Your incision will not be exposed to any of the air we are breathing. Your surgical incision will be covered with a special dressing called an Aqua cell dressing. This dressing is special for lots of reasons. It has silver in it, which helps to kill bacteria. It has a soft pad in the middle, which will help soak up any moisture from the incision. And it is designed to stay on for long periods of time. We may change it while you're in the hospital, but once you are discharged home, it will remain in place until your post-operative appointment at the office. If the dressing starts leaking or falling apart prior to your appointment, please call the office and they will instruct you on what to do. One of the risks of anesthesia is a post-operative pneumonia developing. This is because when you are under anesthesia, your lungs are not functioning as they normally would. Using an incentive spirometer after surgery can help reduce the risk of post-operative pneumonia. We will use this device frequently to take deep inhale breaths. Your nurse will demonstrate how to use this device while in the hospital. One of the major risks of surgery on the lower extremities is forming a blood clot. We take multiple steps to prevent blood clots from forming. The first step is early mobilization. We get 90% of our patients up with physical therapy on the same day of surgery. We also use these elastic compression stockings shown in the bottom right corner. These will help with your post-operative swelling. The top picture shows a Venodyne boot. These will alternately inflate while you are laying in bed and mimic a walking action while you are laying down. The most important thing to be aware of is that every patient will be discharged on a blood-thinning medication. The medication used will depend on your medical history. We will discuss this both before your surgery and after your surgery. It is important to never stop taking your medication on your own. If there are any issues obtaining your medication or any side effects from the medication, such as bleeding, you need to call the office immediately.